Every night you make a choice without even thinking about it. You roll onto your left side or your right side, or maybe you stay on your back, and while you're sleeping, your body is doing something remarkable. Your organs are shifting position. Your blood flow is changing direction. Your digestive system is either working with gravity or fighting against it. And here's what almost nobody talks about. Research suggests that which side you choose might influence everything from your heart's workload to how well your body clears waste from your brain during those crucial nighttime hours. Now, I want to be clear from the start. We're not talking about cures or medical treatments here. We're talking about understanding what happens inside your body when you shift from one side to the other, and what you're about to learn might help explain some things you've been experiencing for years without understanding why. By the end of this video, you'll have information that most people never think to ask their doctor about. Information that could help you make more informed choices about something you do every single night. Before we dive in, tell me your age and where you're watching from. And if something raises a question in your mind, you can ask it in the comments. I'll reply. Now, imagine someone who's been dealing with occasional heartburn for the past 5 years. They've tried different foods, different meal times, even raised the head of their bed. Nothing seems to make a consistent difference. What they don't realize is that every night they're sleeping primarily on their right side because that's just the side that feels more comfortable to them. Meanwhile, their stomach's anatomy is working against them in ways they never considered. Or imagine someone else who wakes up with a slightly elevated heart rate more nights than not, or who experiences what feels like mild pressure in their chest during sleep. They mention it to their doctor, tests come back normal, and everyone moves on, but no one ever asks them which side they sleep on, or whether changing that simple variable might alter their experience. This is what I call the invisible mechanics gap, the space between what's happening in your body and what you're consciously aware of, and sleep position sits right in the middle of that gap. Here's why this matters more than you might think, especially as we age. You spend roughly 1/3 of your life in a horizontal position. That's 8 hours every single day when your body is operating under completely different physical rules than when you're upright. Gravity is pulling on your organs differently. Blood flow patterns shift. The lymphatic system, which helps clear waste from your brain, operates most efficiently during sleep. And all of these processes can be influenced by something as simple as whether your left shoulder or your right shoulder is pressed into the mattress. The consequences of not understanding this aren't dramatic or immediate. You won't have a medical emergency because you slept on the wrong side, but over months and years, you might be unknowingly making certain body processes work harder than they need to. You might be experiencing discomfort that has a surprisingly straightforward explanation. And most importantly, you might be missing an opportunity to work with your body's natural design instead of against it. That matters particularly when you're trying to maintain quality of life and comfort as you get older. And this is where things start to shift. You don't need expensive equipment. You don't need supplements or complicated routines. You don't even need to change your entire sleep setup. What you need is to understand the mechanics of what's actually happening inside your body during sleep, so you can make one small adjustment that might make those 8 hours work better for you. And here's the contrarian part that most sleep advice completely misses. The mainstream conversation about sleep focuses almost exclusively on duration and sleep quality metrics. How many hours did you get? Did you reach deep sleep? What's your sleep score? But almost no one talks about the physical positioning of your organs during those hours, even though your body has a clear anatomical arrangement that responds to gravity in predictable ways. The absence of this conversation doesn't mean it's not important. It means we've been asking the wrong questions. So let's ask better ones. Let's start with what's actually happening when you lie on your left side versus your right side and why your organs care about the difference. Let me walk you through the basic anatomy here, because once you understand the layout, everything else makes more sense. Your stomach is not centered in your body. It's positioned on the left side of your abdominal cavity, with the entrance from your esophagus on the right side of the stomach and the exit to your small intestine on the left side. This isn't random. This is your body's design. When you lie on your left side, gravity helps keep stomach contents in the main body of the stomach and encourages movement toward the exit into your intestines. The entrance from your esophagus is physically higher up, which means stomach acid has to work against gravity to reach that entrance and potentially move upward. According to research published in the Journal of Clinical Gastroenterology, left-side sleeping may be associated with reduced acid reflux episodes compared to right-side sleeping in some individuals. The study suggests this positioning takes advantage of the stomach's natural anatomy and gravity's influence on gastric contents. Now flip that around. When you lie on your right side, the stomach's entrance sits lower than the main body of the stomach. Gravity can now potentially encourage stomach contents, including acid, to pull near that entrance. For some people, particularly those with a weakened lower esophageal sphincter, this positioning might make it easier for acid to move up into the esophagus. Research in the American Journal of Gastroenterology has indicated that right lateral positioning during sleep was associated with increased esophageal acid exposure time in patients with reflux symptoms. Again, results vary significantly between individuals. Let's talk about your heart next, because this is where the physics gets particularly interesting. Your heart sits slightly left of center in your chest, and it's not fixed in place like a statue. It's suspended in a fluid-filled sac called the pericardium, which allows for some movement. When you lie on your left side, your heart is literally closer to the mattress. Some early studies suggested this might increase the workload slightly for certain individuals, though more recent research has been mixed on this point. What we do know is that body position affects how blood returns to the heart through the venous system. Studies in journals like Circulation have examined how sleep position influences cardiovascular parameters. Some research suggests that left lateral positioning might be beneficial for heart failure patients by potentially reducing certain hemodynamic stresses, though this remains an area of ongoing investigation. For healthy individuals, the differences in cardiac workload between left and right side sleeping appear to be minimal in most cases. However, people with certain heart conditions might notice positional differences in their symptoms, which is why individual medical guidance matters here. There's also your lymphatic system to consider, particularly the glymphatic system in the brain. This is what I call your nighttime cleaning crew. Research published in the Journal of Neuroscience has explored how sleep position might influence the brain's waste clearance processes. Some animal studies have suggested that lateral sleeping positions, whether left or right, might facilitate this clearance more efficiently than back sleeping, though human research in this area is still developing. The theory is that side sleeping might help maintain more optimal interstitial space in the brain for fluid movement and waste removal. Now, here's what's interesting. Most people think about sleep position and digestion only in terms of heartburn, but the relationship goes deeper than that. Your entire digestive tract has a directional flow, and that flow can be either supported or complicated by how you position your body during the long hours of sleep. Imagine someone who regularly eats dinner around 6 or 7 in the evening and goes to bed around 10 p.m. By bedtime, food has moved from the stomach into the small intestine, where the bulk of nutrient absorption happens. The small intestine isn't just a straight tube. It loops and curves through your abdominal cavity in a very specific pattern. The natural flow moves from left to right, initially following what's called the duodenum and then the guinea. When you sleep on your left side, you're potentially working with this natural anatomical layout. Some researchers have theorized that left side sleeping might support the progression of intestinal contents through the ileoal valve, the gateway between your small and large intestine, which sits on the right side of your abdomen. From there, the colon ascends. On your right side, crosses horizontally and descends on your left side before reaching the sigmoid colon and rectum. This is the invisible mechanics gap I mentioned earlier. Your body has this entire transit system operating while you sleep, and position might influence how smoothly that transit occurs. Research in this area remains somewhat limited, but some studies have examined sleep position and gastrointestinal symptoms. A study in the Journal of Clinical Gastroenterology looked at various factors affecting digestive comfort during sleep and noted that positioning might influence symptoms in some individuals, though the mechanisms aren't fully understood. What we can say is that many gastroenterologists are aware of these anatomical considerations and sometimes discuss sleep position with patients experiencing nighttime digestive symptoms, particularly those with reflux or delayed gastric emptying. There's another factor to consider here, particularly for older adults. Many people take medications that can affect the digestive system. Some medications can slow gastric emptying. Some can affect the tone of the lower esophageal sphincter. Some can cause changes in gut motility. If you're taking multiple medications, which is common as we age, the question of how your body is positioned during the hours those medications are working becomes more relevant. This doesn't mean sleep position will solve medication side effects, but it might be one variable worth considering as part of a broader conversation with your healthcare provider about managing symptoms. Let's move deeper into the cardiovascular piece because this is where individual variation becomes really important. Your circulatory system operates under pressure. Blood moves from areas of higher pressure to areas of lower pressure, and your heart is the pump that maintains those pressure gradients. When you change position, you change how gravity affects that entire system. Think about what happens to blood return from your lower body when you're lying down versus standing. When you're upright, your heart has to work against gravity to pull blood up from your legs. When you're horizontal, that gravitational challenge disappears and blood return becomes easier. But here's the nuance. When you lie on your left side, specifically, some researchers have theorized that this might affect the large veins that return blood to your heart, particularly the inferior vena cava, which runs along the right side of your spine. Research published in Sleep Medicine Reviews has examined how body position during sleep influences cardiovascular function. Studies have noted that positional changes can affect heart rate variability, blood pressure patterns during sleep, and even the occurrence of certain arrhythmias in susceptible individuals. For most healthy people, these changes are well within normal ranges and not clinically significant. But for someone with heart failure, coronary artery disease, or certain arrhythmias, sleep position might contribute to symptom variation from night to night. There's also the question of sleep apnea, which affects a substantial number of older adults. Research has consistently shown that back sleeping, also called supine sleeping, is often associated with more frequent and severe apnea episodes compared to side sleeping. This happens because when you're on your back, gravity pulls the tongue and soft tissues of the throat backward, which can narrow or block the airway. According to studies in the Journal of Clinical Sleep Medicine, positional therapy, which involves encouraging side sleeping, can reduce apnea severity in many patients with positional obstructive sleep apnea. But here's where it gets more specific. Some research has suggested potential differences between left and right side sleeping for people with both sleep apnea and heart conditions. A study in the European Respiratory Journal examined sleep position in patients with combined heart failure and sleep apnea and noted that left lateral positioning was sometimes associated with reduced apnea frequency compared to right lateral positioning in certain patients. The proposed mechanism involves how different positions might affect venous return and pulmonary fluid distribution. However, this remains an area where more research is needed, and individual responses vary considerably. Now, here's what you need to understand. If you have diagnosed cardiovascular conditions, you should absolutely discuss sleep position with your cardiologist. Some heart patients are specifically advised to avoid sleeping on their left side because of how it positions the heart within the chest cavity. Others might be encouraged toward left side sleeping for different reasons related to their specific condition. This is not one-size-fits-all advice. This is anatomy-specific and condition-specific information that needs to be personalized. What I'm giving you here is the framework for understanding why sleep position might matter for cardiovascular function so you can have an informed conversation with your own healthcare team. Before we talk about practical application, we need to address the real-world complications that make sleep position more than just a simple choice. First, there's individual comfort. Some people simply cannot sleep on their left side. It might be due to shoulder pain, hip discomfort, or just a lifelong preference that makes any other position feel unnatural. And that's completely valid. The goal here is not to force yourself into a position that prevents you from sleeping well. Poor sleep quality will cause far more problems than sleeping on a less than optimal side. There are also structural considerations. If you have arthritis in one hip, sleeping on that side might be genuinely painful. If you have rotator cuff problems in one shoulder, you might need to favor the opposite side, regardless of what might be theoretically better for your digestion or cardiovascular system. If you've had surgery on one side of your body, your surgeon might have given you specific instructions about sleeping position during recovery. These factors take precedence. Your body's immediate comfort and healing needs come first. For pregnant women, left side sleeping becomes particularly important in later stages of pregnancy. Research published in Obstetrics and Gynecology has indicated that left lateral sleeping position may be associated with better outcomes, possibly because it reduces pressure on the inferior vena cava and optimizes blood flow to the placenta. The American College of Obstetricians and Gynecologists includes sleep position in their guidance for pregnant women. However, even in pregnancy, the emphasis is on side sleeping in general, rather than being rigidly fixed on one side all night. Snoring is another practical factor. Many people find that sleeping on their back increases snoring, while side sleeping of either type reduces it. If you share a bed with someone, your sleep position might be influenced by considerations beyond your own physiology. Relationship dynamics and sleep quality for both partners matter. Sometimes the best sleep position is the one that allows both people to actually get rest, even if it's not theoretically optimal from a purely individual physiological standpoint. There's also the simple reality that most people don't stay in one position all night. Sleep studies using position sensors have shown that people typically change positions multiple times during the night, often without remembering it. You might start on your left side and wake up on your right side or on your back. This is normal. The question isn't about maintaining a rigid position for 8 solid hours. The question is about which position you're in for the majority of the time, particularly during the deeper stages of sleep when your body is doing the most restorative work. So here's a question worth asking. If sleep position can influence digestion, cardiovascular function, and even brain waste clearance, why isn't this part of standard health advice? Why don't doctors routinely ask about sleep position during checkups? The answer reveals something important about how medical knowledge gets translated into practical guidance. First, the research exists, but it's scattered across different specialties. Gastroenterologists might be aware of the reflux research. Cardiologists might know about the cardiovascular studies. Sleep medicine specialists understand the apnea connection. But this information doesn't always get synthesized into simple, actionable guidance that crosses specialty boundaries. Medical education focuses on diagnosis and treatment of disease, not on optimizing the mechanical positioning of organs during rest. That's not a criticism. That's just the reality of how medical training is structured. Second, the effects of sleep position are generally subtle for healthy individuals. They're not dramatic or immediate. You won't feel radically different after one night of sleeping on your left side instead of your right. The potential benefits, if they exist for you, would accumulate gradually over time. That makes them harder to study rigorously and harder to motivate people to pay attention to. Medicine tends to focus on interventions with clear, measurable effects. Sleep position falls into a gray area where the theoretical basis is sound, but the individual variation is enormous. Third, there's the challenge of individual experimentation. Unlike taking a medication where you can clearly attribute changes to the intervention, sleep quality has so many variables that it's difficult to isolate the effect of position alone. Was last night better because you slept on your left side, or because you ate dinner earlier, or because you were less stressed, or because the room was cooler? This makes it hard for people to figure out what actually works for them, and it makes it hard for researchers to design studies that control for all the confounding factors. But here's what I want you to understand. The absence of widespread mainstream guidance doesn't mean this information isn't valuable. It means you have an opportunity to experiment and observe your own body's responses in a way that most people never think to do. You now understand the mechanical and anatomical basis for why position might matter. That understanding gives you the framework to make informed observations about your own experience. And that's powerful because you're the expert on your own body. Let me bring this together for you. You've just learned something that positions you ahead of most people in understanding the invisible mechanics gap, the space between what's happening inside your body during sleep and what you're consciously aware of. You now know that your stomach's anatomy creates a directional preference that might influence reflux. You understand that your heart's position might be affected by which side bears your weight. You've learned that side sleeping in general might support brain waste clearance and reduce sleep apnea severity compared to back sleeping. More importantly, you understand why this information exists in the research literature, but rarely makes it into everyday conversation. It's not because it's unimportant, it's because the effects are individual. The research spans multiple specialties, and the practical application requires personal experimentation rather than universal prescription. That actually makes this information more valuable, not less, because you're now equipped to investigate what works specifically for your body rather than following generic advice that might not apply to you. Here's what you can do starting tonight. First, pay attention to your baseline for the next week. Simply notice which position you naturally gravitate toward during sleep. You might already be doing what works best for your body. If you consistently wake up on one side, that's valuable information. If you experience reflux, note whether it happens more on nights when you sleep on your right side versus your left side. If you have cardiovascular symptoms during sleep, observe whether position correlates with symptom variation. Second, if you want to experiment with left side sleeping, make it comfortable. Use a pillow between your knees to maintain hip alignment. Make sure your shoulder isn't compressed in a way that causes pain. Consider a body pillow that helps you maintain the position without conscious effort. The goal is to make the position sustainable, not to force yourself into discomfort. Remember, sleep quality matters more than sleeping in a theoretically optimal position that prevents you from actually resting well. Third, track your observations. Keep a simple sleep journal for 2 weeks. Note your sleep position, how you feel in the morning, whether you experienced any reflux or cardiovascular symptoms, and your overall sleep quality. Look for patterns. This isn't about achieving perfection. It's about gathering data on your own physiology so you can make informed adjustments. You might discover that position makes a noticeable difference for you, or you might find that other factors matter more. Either finding is valuable. Fourth, and this is critical, discuss this with your healthcare provider. If you have any diagnosed medical conditions, particularly cardiovascular disease, significant reflux, sleep apnea, or if you're taking multiple medications that affect these symptoms, your doctor might have specific guidance based on your medical history. They might want to adjust your treatment plan if positional factors are contributing to your symptoms. This information doesn't replace medical care. It enhances it by giving you and your doctor more variables to consider. Now, here's what makes you different from most people. After watching this video, you understand that your body operates according to mechanical principles that don't stop just because you're asleep. You recognize that anatomical positioning matters. You know that the invisible mechanics gap exists and that you can bridge it through informed observation and experimentation. That awareness puts you in a position to make adjustments that most people never consider. Not because those people aren't smart, but because nobody ever explained the underlying principles to them. I want to hear about your experience. Have you noticed differences in how you feel based on sleep position? Have you experimented with changing your sleep side? What did you observe? Share your thoughts in the comments below. Your observations might help someone else understand their own body better. And that's the whole point of building this community of informed, thoughtful people who want to understand the why behind their health. In the next video, we're going to explore another invisible mechanic that affects your body every single day but rarely gets discussed in mainstream health advice. We're going to talk about why the temperature of the water you drink might influence your metabolism and digestion in ways you never considered and what the research actually says versus what the popular wellness industry claims. It's going to challenge some assumptions and it's going to give you concrete, practical information you can use immediately. Make sure you're subscribed so you don't miss it. Remember, you're more informed than most people now. You understand the invisible mechanics gap. You know that your body follows predictable physical principles even during sleep. And you're equipped to investigate what works specifically for you. That's real empowerment, not promises of miracle cures, but understanding of how your body actually functions so you can work with it intelligently. That's what this channel is about, and I'm glad you're here.